Hi everybody and welcome. My name is Kate Hutchinson and I am the trans officer for Pride Cymru. Next up, we have got an event I'm really excited about myself. We have got a trans healthcare Q&A. We have the fantastic Dr Sophie Quinney, who offered to do the session with us, because I think it's really important. A lot of the trans community are quite worried about their healthcare or worried about how to engage with their healthcare. So having this session where we've collected questions from the community, I think is really, a really positive thing. So I just want to introduce Sophie and say thank you very much for offering this session we're going to go through today.
No problem, Kate. Pleasure.
Fantastic. So, am I right? So you work for the Welsh Gender Service? I do. Okay.
I'm wearing my lanyard.
Tell us a little bit about the service and when it was set up and how it got there.
Gosh, I think it's this service has been a long time in the making. I think it's carried on the backs of the trans community, which is why I feel so honoured to be part of it. I've been following its evolution for the last 3 years. When I started I was a GP, sat in a surgery, probably somewhere in the South Wales valleys, and I was struggling along with one of my trans masculine patients, trying to work out what do I do. And, I sort of set upon a sort of a task for myself to try to better understand this area of health. And that led me all the way to sort of getting involved with some of the meetings that were going on at the time. This service didn't exist at that point, but it was certainly there on paper. So I've had the honour and privilege of following it for the last few years and contributing to its development where I can, with a sort of a professional hat on. But really, I would say that this service belongs to the trans community because it's been shaped and honed to best cater to their needs, and learning from, learning lessons from our sort of friends over the border in England to see where things have been done really well and where things haven't been done well, and trying within our limits to give a first-class service here.
Yeah, I mean, I've, as one of the community who've been part of that process,
Yep.
As it was shaped, it's been fantastic to see that. I mean, it's like any of these processes, it has its ups and downs as you go through that process in trying to get it into place. What are some of the differences between how the system is in Wales compared to in England? How does that work slightly differently to the English system?
Yep. So we've adopted some of the things that we think are done really well. So, for example, because we now have our own service, we don't require people to go through the mental health teams. If they're age 17 and a half and over, they can be referred directly now to the Welsh Service by their GP. So that's a huge relief to have that put in place. Obviously, people under that age, we still rely on the Tavistock and Portman Trust, the young person service there, the GID service they call it. So we do require young people to attend their GP surgery and be referred through the CAM service, and on then to the London team. But certainly for adults, we've managed to get rid of the mental health component, which is great. So that's a positive. I think the thing that we do differently, and I would argue better, I think, owing to our smaller size in Wales, is that we no longer have a postcode lottery for people who are seeking hormone therapy as part of their transition process. So we now are able to ensure that hormone therapies are available closer to people's homes, and that they are standardised and overseen by ourselves. So we have what's called local gender teams, one in every health board, and they provide the initiation and monitoring of hormone therapies for people as they come out of the service. So I'm very, very proud of that. As a GP myself, I helped to set that up, and I know most of the prescribers very, very well, and they're all absolutely dedicated and excellent clinicians. So that's going really, really well. And I think the other thing that we're doing differently is that we have active management of our waiting list, in the sense that we have peer support available for people, so that at least they can tap into someone with a lived experience while they are waiting to see us. So that gives us a greater sense of security, that we know that people at least have got someone they can reach out to if they're struggling, because obviously waiting times are one of the biggest challenges that we're all facing across the NHS, particularly for this service.
Yeah, especially in times of COVID as well, because I mean, I remember the system I went through. So I went through, when I had sort of medical support, it was the case of I went to my GP, then I went to the community mental health team, then I was on the waiting list to go to Charing Cross in London. So I live in North Wales, so that was like a 2-hour train journey to get there and back, and that caused a lot of anxiety for things like just that sort of travel, and then you go into one of the busiest cities in the country. And then to see, how this service has evolved, it's been really good, really positive. Maybe England can learn something from Wales as regards this.
Yeah, I mean, my motto is to build relationships, and I'm a really keen co-worker, and I like to share good evidence-based practice. So I have very close links with London, because I did a lot of my specialist training there. Obviously, I trained as a GP in Wales, but then I trained again in this area with Charing Cross. So I'm very, very close to them, and we establish links with the other clinics across the UK, and we always give everyone a very warm Welsh welcome, and I'm very open to sharing all of the content that I develop, all of the learning materials that I develop with GPs across the border as well. And also I would give a mention to Scotland, because Scotland do some remarkable work, and they're very progressive there, and so we like to keep in close contact with our Celtic neighbours, and of course over in the Republic as well. So
yeah, Scotland generally, as far as trans rights go, are doing some really positive stuff. Actually, I didn't even tell you I was going to ask you this, but hey, I'll drop it in there.
Go on.
What was the thing? How did you yourself really get involved with trans healthcare? Was it a particular thing that you wanted to do? Was it something you just happened to end up in?
Yeah, the latter. Yeah. I think I hinted at it earlier. I was that confused GP. I was that person that was faced with somebody who was actually seeking asylum, so seeking sanctuary in the UK. A trans man who was, self-administering testosterone, came to me for help, and I had absolutely no idea. We're trained as generalists. We provide an essential services contract. This wasn't part of my training. I'd never come across it in medical school, in foundation training. And I just had absolutely not the foggiest idea about where I needed to start. Mm-hmm. And that's where it started for me. I thought, well, I'm a member of the LGBTQI community. These are my brothers and my sisters and my siblings. And I thought the more I understood about it, the more I felt that there was this huge unmet need, both for patients in this country, but also for GPs and health professionals as well, who lack that training opportunity. And I thought, right, this is what I need to do. So that's what I did. I dropped, everything, and I went and spent 6 months, well, a year in the end, in London, back and forth on the train, kipping with my brother in Surbiton, and it's been an evolution, really. But I would say that the trans community in Wales has taught me pretty much all I need to know as well. I would say that I had a double training, if that makes sense. So I owe that to them as well.
Fantastic. We've got a load of questions, to be honest. So we put a call out via social media, and I actually went out to a few people personally who I knew wanted, I knew they'd had things they were trying to find out about healthcare.
Yes.
So we put out the call far and wide to see, and we got a variety of questions, to be honest. So we could just start going through some of them, and you've actually touched on a couple of them.
Okay.
As we've just been chatting. So for a lot of people, initially it's quite hard even to reach out and go to your GP. I know when I transitioned, when this time round I tried to transition about, 8 years ago now, 8 years ago. Just going to my GP was a very scary experience. Is the level of our GPs generally knowledge increased now, do you think, a lot generally, or are there still gaps? Because we have had a question where people have said that they've been to their GP and the GP hasn't been too sure on where to direct them when they've got there.
Yeah. And there's definitely, there's always things that can be done in terms of what we've been able to do in the last couple of years. I've been really grateful to have been invited to do some training for GP trainees. So that's the next generation of GPs coming through. Some as early as August, some of the people that I've trained are coming now into roles. So I think dealing with education, making sure that it is on the curriculum for GPs, even if it's just to understand the basics in how they consult in an affirming way. You talked about people feeling that there's a barrier there, that they're scared to even go and open up that conversation. I think it does. You have to pare it right down to the basics to say, to give GPs the absolute grounding. And that through that behavior, then that filters into the community. The community will have had a positive experience. They report it on social media. People pick up on it. And then that's a cumulative effect. That training then gets expanded. So I've now developed online modules where people that can't get to training can train. So it gives them a grounding. And I think we're getting there. We're a small family, both as part of the LGBTQI community, but also a GP. There are 1,200 GPs in Wales. And might think that's a lot, but it isn't. I've been around as a GP for 5 years. So people will informally reach out to me to say, help, can you help me here? I might give them a quick phone call. I think we're getting there. It's patchy, but I think we're getting there, and we're starting now to fill in the gaps. So, yeah, I'm positive.
It's positive to hear, because, again, I've only got my own experience from way back, and I have to say for myself, even back then, it was actually a positive experience, because it just happened that my GP had previous trans patients. So he was like, yeah, right, I know what we need to do, and that's it. And that makes a big difference. If you just hear that, even if it's just a positive attitude of like, I know where we need to go with this, that can just lift you quite high and give you that positive attitude going forward with it.
Yeah, absolutely. That first contact is absolutely essential. And I would say also it's the way in which you're greeted at the reception as well, because let's not forget that a trip to the GP is also, there are stages, aren't there? It's approaching the reception, waiting in the waiting area, being called in, having your contact, and then leaving. So it's making sure that staff at every level have awareness and sensitivity. And also now in times of COVID, over the phone. So when we're talking over the phone, it's really important not to assume and, to use gender neutral language where we can. So it's those things, I think, that make the biggest difference to people.
So actually, you touched on COVID there. We might as well have a quick chat about that, because, it's a funny old year, and it's been very challenging times for a lot of people in a lot of professions and just lives in general. So with the Welsh Gender Service, are appointments still going on during lockdown and during the pandemic? And if they are, how are you actually going about that?
Yep. So I started in my role as COVID broke. So I was sort of there when it all happened, rushing to assemble my home office and get my IT sorted out. And the very first thing that the service did was reach out, usually by telephone, to the patients that were currently in the system, so the ones that had been seen, and we reached out with phone calls, so the whole team, got on the phone and got hold of people to make sure that they were okay, and that could be anything from, people having therapeutic sessions to people who were worried about hormones continuing. We did lose our endocrine team because they were redeployed to COVID. I do have medical training, but I wasn't redeployed. I stayed behind to kind of manage the Welsh Gender Service elements. So we were able to shore up hormone supplies. All of our local gender teams were able to stay open, even if it was remotely. And I was able to plug some gaps by sending out prescriptions. So we made sure that nobody went without hormones during the pandemic, which was a critical thing. The therapy sessions continued, so there was no interruption to people who were having some psychological therapies. Because Dr. Rafferty, who's our consultant psychologist, was able to do that via the telephone, so that wasn't interrupted. And then we got on board with video consulting, and as soon as we were ready to go with that, I think that was May, we started doing video consultations. So I think there's some people probably listening today who recognise Marsha and Sylvia, because they sit there, place of honour behind me, and they'll have spoken to me just like we're speaking now, using video consulting, and we've been able to continue on with all of the regular assessments. So we started doing follow-ups, just to see follow-up patients, and then we started with new patients then later on in May. So yeah, we haven't really stopped. Which is good. We've been able to sort of stay as open and operational as we could.
Sounds like an extremely busy time for you, though.
Yeah. Yes, I'm not very IT savvy, so it was pretty hellish to find myself with 4 computers having to work out what they did, but I got there in the end, yeah.
And we are pre-recording this, I have to say, on Monday, and it's actually today would have been Marsha's 75th birthday, so happy birthday, Marsha,
Absolutely.
Absolute icon.
Yeah.
Yeah, so initially, if there is somebody who might be watching this and they're thinking about, they're maybe thinking about their own identity and the fact they think they might be trans or non-binary, or they might need a little bit of support, what do you think their first steps should be, really?
It's a good question. I suppose, given the length of the waiting times, and I have no doubt you've been asked plenty of questions about that, because it's always a big one. I would suggest making an arrangement to speak with the GP to ask for a referral, because at the end of the day, if it goes in, then it's in, isn't it? And you've got a bit of thinking space then to sort of think about what you'd like to do. And I think it's really important to point out that not everybody who has a trans identity needs to use medical intervention. So there's so much that people can do that don't require NHS services. Elements of social transition can be enough for a lot of people, and that's absolutely fine. And it's very easy to sort of say, well, actually, I've got my referral in, but actually, I've reached this point in my transition and I'm very happy with that. Being on the waiting list also means that, there is a bit of additional peer support, as I explained to you earlier. Everybody that joins our service is offered the option to opt in to receive 5 or 6 contacts from somebody with lived experience, which gives them a little bit of time to talk to somebody, to reflect on their own experiences and learn from somebody else's, to help to sort of determine perhaps what might need to be done. And maybe there are just some simple things that might help to make people feel more comfortable. That might just be to do with the way that they express their gender, or they might just want to have time to share stories about their experiences. So I would always say it's worth doing if somebody feels that they might want to access a medical service for medical support.
One of the questions we had actually was along those lines. It was around somebody who wants to transition probably socially. So when I talk about that, for anybody who's not aware, a social transition, it means, taking steps to live your life, as your authentic gender identity. So it might be a number of things. It might be changing your name. It might be using different pronouns, the ones that you used before. It could be the way you outwardly express yourself to the world, clothing, etc. It can be lots of different things. Whereas a medical transition might be physical things that you do and that side of it, and where you might request medical support. So we did have a question where somebody said they don't think they want to medically transition, like they don't want to make any sort of bodily sort of alterations in one, I think the way it was actually phrased, but can they still access psychological support or care through that, which I'm pretty much guessing you just said they could?
Yes, I mean, there's all sorts of, define psychological care. Sometimes for some people that's a really good book. For some people that's a really good therapist to sit and talk through, their gender specific therapy. You can access that in a number of ways. There are some very good private therapists, so I wouldn't want someone to wait 2 years to access that, because I think there's so many brilliant therapists out there. If it was that sort of psychological support, sometimes it can just be joining a Facebook group, of like-minded people and going to Zoom chats, or when COVID's over, going to a meetup or something. I think the idea is that it's a therapeutic environment, however we define that. And I think that there's so much to be said for making friends with people that you really resonate with. It can do wonders for people's confidence and sense of identity. I
think peer support is absolute key. I think you're absolutely right about that.
It absolutely is. And then, I think it's also maybe worth mentioning that the peer support workers are, trained, and kind of the oversight for their work is done by Umbrella Cymru. For those of you who don't know Umbrella Cymru, it's a absolutely fantastic charity that covers all of Wales. So it's a national level charity, and they can offer extra support if it's picked up that somebody might need additional support, and sort of signpost people towards that. So it's a really helpful way of kind of, plugging into where there might be a need for extra services, and that could be around housing, the workplace, that can be all sorts of things. So they're a brilliant organisation, and we're so thrilled that they partner with us in the NHS, because it just adds that, like you said, that it just adds that extra dimension.
Fantastic. I had a question as well about geography, I suppose, from somebody up in North Wales wondering about, they're telling us that they're currently out of work, and they're worried about if they needed to come to where you're sited in the south, would they get any help with that as far as travel costs? Because I've heard in the English system, if somebody had to go to Charing Cross Gender Identity Clinic, they could sort of claim money back if they were unemployed. Do you know anything about that?
Yeah, there is a reimbursement system. So travelling for healthcare within Wales can be reimbursed for this particular service. I've looked at the booklet, but that was a while ago now. So there are forms to fill out, of course. This is the NHS after all. But I think the other thing to say is that one of the real positives that's come out of COVID is remote working, is video consulting. So what I would say to that particular person and other people who, for one reason or another, feel that they can't travel to Cardiff, that could be for mental health reasons, that could be financial, that could be all sorts of reasons, that we are really keen in this service to keep remote working as a component of our work after COVID, and keep it as a way of making sure that everybody has access to us, regardless of where they live in Wales, because we were thinking about that before COVID happened. How can we make sure that we don't disadvantage people who are geographically remote to Cardiff? And this came along, and it's gone so well so far. We've had such positive feedback from people who've done it that we're hoping to keep it on as an option for people. There are going to be times when people do need to come down to see us. And yes, we can help them to put in a claim to reimburse their travel expenses.
That's fantastic. Regarding going back to waiting lists as well, because we had another question here asking about if somebody who's currently waiting on a list to be seen by the service, and they decide they want to socially transition anyway before that happens.
Yep.
They want to know if it's possible for the GP to their GP to change their name and their gender on their records to a gender that and a name that represents them more authentically.
Yep. Good question. And yes, you can, absolutely. You don't need anything except for a letter that you've signed. If you're 18 and over, you can simply just send them that letter, deliver it to the surgery with the changes that you'd like. And obviously those things include change of gender marker, change of name, and change of title. You can't change your age, unfortunately. I tried that one. Didn't work. But yeah, you can do that. And of course, a deed poll is something that you can access if you're British and over 18. You can access for free online, or you can have a statutory declaration organised by a solicitor for a small fee with a nice stamp on it. So any of those documents are acceptable in order to change your details with your GP. But you don't need to have one. But I think having a deed poll is quite nice, because it means that you can send that out to everywhere that you're registered, including your driving license, and have that documentation changed. The only thing that you can't change just with a deed poll is a passport. You would need an additional supportive letter from your GP or a healthcare professional of sorts to get that done. But everything else, so it's quite handy. It's worth getting a deed poll done and then submitting that to your GP and getting everything changed over. So, yeah, absolutely.
Oh, and there is that one other certificate you can't get changed without another piece of paper, which is your birth certificate. But that's a whole other conversation. That's
true. Yes. Well, yes. Gender recognition certificates take a little bit more money and a little bit more work. And obviously that would be how you change your birth certificate at the moment. Yeah, that's right. It's
important to just quickly note, because we're not going down that route, but that's the only thing you need. That's certificate for the gender recognition certificate to change your birth certificate. That's it. You can get a passport. You can get all your other ID.
Yeah.
With as you've just said there, with passport with supporting letters. What else have we got here? We've got so many. So how long? So somebody accessing the service has asked basically, how long would it take them to access hormone treatment and then surgery after they have their first appointments with the clinic? I know it can be different for every person, but a rough sort of timeline of how the process might be
for
somebody wanting medical support.
Yeah. Okay. I'm just going to assume that this person is sort of ready. Obviously, we have to, although we practice in a very affirmative way, we affirm people's gender. If you tell me that this is your gender, that's your gender. That's not in question. But there are obviously eligibility criteria for people that want to access medical intervention in the form of, let's say, hormone therapy. But let's say that somebody is ready to go at the first appointment. That can be done. So we're not. What we try to do in the Welsh Gender Service is meet people where they're at. So that could be that somebody has undertaken a social role transition, things along the lines that you said. They might have changed their name formally. They might be living in their role, living in an authentic way. They're out to people. They're expressing their gender how they'd like. They're comfortable, but they'd like to access hormone therapy just to help with that, bodily distress or functional distress, whatever it might be. If somebody's at that point where they feel that and they're ready, then that can be discussed and explored in that first appointment. So it might well be that if someone is at that point, that could start on the first appointment. And then it would, I suppose, depend what sort of surgery we were talking about. It might be that people have a non-binary identity or other identity where they don't actually want hormone therapy, but surgery is actually more important to them. So it would be that we would base the discussion in their first appointment, we would base a discussion around that. So we'd spend a bit more time with them talking to them about their own personal transition objectives. But let's suppose somebody wants to start hormone therapy and then move on to a type of gender affirming surgery next. Hormones take a while to work, then you don't wake up, looking particularly different. You might feel different quite quickly, but
I know that one.
Puberty, this is puberty that we're talking about here. So puberty takes time. So we usually like to give a little bit of time for somebody to get accustomed to their puberty and their hormones and their body changing and the way in which they are then, perceived socially and how that works. How is it working not just for their body, but in real life, in the context of their lives. So we like to give a little bit of time for that. And we try to be flexible to kind of work with the patient and their particular goals and their transition pace, because some people don't want to jump straight into surgery, and other people are really saying, okay, that's great. What's next? When do I get to see you again? So we try to be as flexible as we can in terms of responding to their needs, as well as kind of trying to balance that with the needs of new patients who are waiting in line. So I would imagine, that if somebody was to start their hormone therapy, we'd probably like to catch up with them again and see how they're doing and kind of go back to their transition objectives in about 9 months after that, just to see how things are going.
That's it,
and that's where we are now. So don't hold us to that, because obviously, as we get busier, as we expand, we have to balance the needs of when do we follow somebody up again with when do we see someone for the first time. Yeah.
Because I know people who've, when they began their transition, they had a set thing in their mind about what they wanted. And they got to a certain point and realised, as they went down the line, they realised that wasn't as important to them anymore. So maybe for some people I know who've accessed hormone treatment, and for them, they suddenly realised that was life-changing and gave them the level of comfort and subsided, that dysphoria subsided enough that they felt really comfortable in who they were with that, and that was it. And they decided, I don't actually need surgery anymore. I don't feel like that is a step I need to take now.
Yeah. And you've hit the nail on the head. That's what we're trying to achieve. We're trying to sit with that person and allow that person to really live and experience it, because it's easy to read about what hormones do to the body on a document, but actually really living it is something that people. And it's having that open dialogue with the service where they don't feel that they're going to be shut out, but they also don't feel that they're going to be rushed through. So at the moment, we're trying to be really flexible. And when I consult with people, I get an overview of, okay, where are you at? Where would you like to go? Where do you think you want to go at this point? And what's your timeline, so that we can get an idea about how to best serve somebody's needs. And the other thing that we do is, because that person, if they do start hormone therapy, goes on to the local gender service, we don't feel the need to see people all the time. I think it's really important that we allow that person to get on with their life, because they have a life to live. It's not something they do just, independently of the rest of their lives. And we like to just see how they do and keep in touch through our local gender teams to sort of try to work out the best pace. So that's what we're aiming for, is flexible appointments.
We had one question that actually was surgery related, which was actually asking about top surgery for people who are transmasculine or identify, as men.
Yep.
So for trans men or transmasculine people who might be non-binary, how many signatures do they need from clinicians to be able to access that, when they're at a certain point in their transition?
Yeah. I mean, again, it's about individualized care. It's about the person in front of us. We try to make this an art, not a science. We try to be guided by best practice. And obviously we have policy, restrictions, but we try to be guided by good practice. So it might be that they're eligible and ready after one opinion, and they have one supportive opinion, and that's acceptable by all chest surgeons, to have one opinion from a gender specialist. It might be that they need 2 or 3. It just depends on the individual.
Okay, fantastic. A question actually about young people. So the Welsh Gender Service, do they support young people, or does it go through a different pathway? Can you tell us a little bit about the pathway it does go through for young people within Wales?
Yep. So if you joined at the beginning, I mentioned about people under the age of 17 and a half. At the moment, the GP needs to refer them to CAMHS locally, where they'll have an appointment, and then CAMHS will make a recommendation to the funders, the people who fund their care over in London, and then they will be transferred over there. We have done quite a lot of work, though, to make sure that when people come back, when people approach adulthood, that they are reunited with the Welsh service, and they don't have to wait again. This is the most important thing, I think, is that once you've got your waiting time, that's your waiting time, and it doesn't matter that you've turned 18. We will respect your waiting time for what it has been. So for some young people, it might be that they're already at the top of our list in terms of the waiting time that they've experienced already, and we will see them as close to their 18th birthday as we can. I don't think anyone turning 18 wants to come and sit and talk to me in a Zoom meeting. Maybe they do, I don't know. Maybe I need to get some birthday candles or something ready for 18. But we're trying to see them as close to their 18th birthday as we can accommodate them. And I think that's a really important step that we've managed to put in place to make sure that people aren't then waiting twice. And the other thing that we're doing is reaching out to CAMHS practitioners, some of whom are really, really good and very dedicated to young people, and understand that this is not a mental health condition, that although they are mental health practitioners, that they want to respect and affirm their patients, and just kind of supporting them to support young people. And I think you'll know, Kate, with your work in schools, these things then kind of, sort of leach out into schools and good practice. And so I think we're all trying. And I was at a workshop last week with one of the local gender team prescribers, attending a workshop about young people, listening in to what young people were saying. LGBTQI people who wanted to talk about rights, and this was to feed back to the Children's Commissioner for Wales. We're always listening and wanting to do better and improve, and GPs will write to me to say, I've got this young person, is there anything else that I can do to help them? And I might recommend a good book or a charity, a really good charity that they can reach out to. So, we've got some brilliant charities here and obviously Mermaids, but also here. Let me see. So Youth Cymru are brilliant. There are others that offer services locally as well, not just national ones. So it's that sort of thing, isn't it? It's trying to, although we are a service at the moment for 18-year-olds, we will develop and grow into a lifespan service, but it's what can we do in the meantime to kind of help around the edges. Yeah.
Fantastic. What else have we got? You know what? We're getting through these now. We've got quite a technical question, actually, quite a long one. So if you're prepared for this one, I'll have to read this out. So we had this from an individual. I'm not going to use names because I want to keep them all anonymous. I'm a trans woman. I wanted to ask about the use of progesterone as part of hormone replacement therapy. In the trans community, there's a lot of positive feedback of the effects of taking this, particularly in relation to a positive effect on mental health and breast development. So it's a bit of both questions. It's about physical and mental. It seems that this isn't available via many NHS gender clinics, maybe only via some private services. Can you give any advice on that particular drug and if it is more likely to be available on the NHS?
Yep, that's a question that I'm asked a lot. So it's good to see it there. So thank you to whoever asked that one. So progesterone is a female hormone. I think that there are usually three actually kind of reasons why women say that they'd like to have it added to their hormone therapy. The first is well-being. Some people do report sort of an enhanced sense of well-being. Some women talk about breast development, as you said, and around the sort of the later stages of breast development, it's thought to play a role in female puberty, because if you think about female puberty, the breast development starts first, and then the progesterone through estrogen, the action of estrogen, and then the second female hormone starts to be produced. But it does happen quite late on in puberty, so the final stages, and there is a question around whether progesterone might have a role in cisgender people in finishing off that breast development. So that's probably what that relates to. And then there's a third element of the request is often that women feel that they're not complete if they don't have both of the female hormones. I'll start backwards. So that latter element, obviously, if you think about HRT use for cisgender women, we only add progesterone for women who have a uterus, because progesterone is estrogen on its own is thought to have a bearing on risk to develop cancer of the uterus. So for cisgender women using HRT, we don't actually offer progesterone for women with no uterus. So I would say that for women without a uterus, we are doing the right thing by using estrogen-only therapy, because that's no different to how we would treat any woman without a uterus. That's the first thing. In terms of breast development, we often extrapolate. So we often look at the evidence that we have that often, sadly, relates to cis women, and try to sort of think about how that might translate for women, trans feminine women. And it's not always entirely accurate. So this question over breast development and does progesterone help trans women's breast development, the trials so far are quite small in their number, and they don't last very long. So it's quite difficult to say with any certainty whether that would be a useful type of therapy to potentially add in at that last stage in breast development. Certainly, we do know that progesterone does tend to have some negative impacts on health, so it can increase the risk of cardiovascular disease, so things like blood pressure, stroke, things like that. So we always have to balance it. And I think the short answer is, and well-being, sorry, the last thing, the well-being thing, is I hear it a fair bit, but we don't have strong evidence for it because so much of it is anecdotal. It's word of mouth, and it's very difficult to measure well-being. People try, but there's so many other conflicting kind of components into someone's well-being. We're never quite sure whether this is an effect or not. I think fundamentally, in terms of the NHS in Wales using it, I think we need more data, because as always in the NHS, we're evidence-based. We need to use the evidence. In general, we need to involve trans people in our evidence base. We need to be doing these trials for and with trans people, because they are unique. It's no good just relying on data that doesn't specifically answer the questions. And I think we need to do longer trials as well, over a longer period of time. I'm not an endocrinologist, but it's certainly something that we're aware of. It's certainly something that the trans community are interested in. At the moment, we feel it's outweighed by risk, so the benefit and risk don't weigh up. But we would be interested in setting up our own clinical trial to study this. And it's a sort of trial that's prospective, so we start and we follow people. So it's definitely something that is on the cards. I hope that answers your question.
Yeah, well, safety always leading things, I guess. That's going to be the
absolutely. Well, we have to base it in evidence. That's the same for any NHS service. So yeah.
I just realised we've gone way over the time we thought we'd do with this, but it's great. We've probably got this time, so it's fine. I've got probably two really quickish ones to finish.
Okay.
Oh, it might be quick. I don't know. We heard from people who access, because they've been, they're on a waiting list, and they get a little bit frustrated because they might be on that waiting list. So they've decided to access private healthcare. And a couple of them have asked actually if they get their initial diagnosis privately, would they be able to then get shared care from the NHS to get their blood tests maybe monitored through the NHS and their prescriptions? Would that be a possibility?
Okay. Well, I mean, if you think of other types of sort of medical conditions where you can, essentially what we're talking about is jumping the queue, because that's what people do if they can afford to. There's a private system, isn't there? So it might be that you've got knee pain and you want to access something sooner, so you pay and you go and see a private clinician. And it's no different really in gender. The thing that I would say as a rule of thumb is that when you're selecting your private clinician, whether that's for your hip, knee, asthma, gender, it's really important to select a consultant who is also working in that capacity in the NHS, and the reason for that is that we base when we receive, as GPs, when we receive letters from private consultants, we look to see what is this person's track record. Are they being properly followed up yearly? Because when you work in the NHS, you have annual reviews, we have to do all sorts of things to keep our portfolio and our training up to date. And so it gives us a benchmark where we can feel confident that the recommendations of that private consultant are good and well-meaning, and that they translate meaningfully into NHS care. So I think what I would say as a rule of thumb is choose your private clinician carefully and make sure that they are also practicing in gender identity in the NHS, just to give them that benchmark that allows that NHS support then to flow, from that.
Fantastic, great
moving
points.
Forward. Yep.
Brilliant. Very last question, because I want to say thank you again for taking part in this. Thank you for offering to do this, because I do see a lot of people frustrated in the community that feel sometimes they can't reach out, or they don't know where to reach out. And just this one-off little thing like this, it's a great opportunity. So thank you so much, Sophie, for that. Just a really little question to finish with is, what are your hopes for the service? Where do you see the service going? What do you hope for the future?
I'm already so proud of it. I'm so proud of the community stakeholders that built this. You know, this was their plan, this was their vision, and I think it's a brilliant one. You know, the secure route for hormone therapy through local gender teams is, we are the envy of our neighbours, I think, in terms of securing that. I'd like to see it become a lifespan service. That's where I'd like to see it. That's my hope. Yeah, that would do. There are a couple of other things that I'm cooking, but I can't reveal too much about it. But they're all good, healthy projects to sort of, you know, advance sexual health care, those sorts of things. But fundamentally, I'd like to see this service become a lifespan service. I think that would be brilliant, and then I can retire and just walk my dog endlessly.
Yay. Thank you so much, Sophie. So thanks everybody for joining us for this. You're probably seeing this on a Friday, I think it's going out. So thank you for those who sent your questions in. Thank you, Sophie, for answering all these questions so brilliantly. And thanks to Liz for the BSL there. Fantastic session. So thank you very much. Goodbye. Happy Pride.